Hello and welcome to this podcast, Expert Voices in Clinical Aromatherapy. In this episode, Rhiannon Lewis, Director of the International Clinical Aromatherapy Network, shares her knowledge of what's going on around the world. She is explaining the similarities and the differences between international aromatherapy practices. Enjoy listening!
It's always interesting to take a global perspective when it comes to examining how aromatherapy is practiced, because in some cases the practices are different according to how aromatherapy evolved in that country, and also there are cultural differences and legal differences as to who can or cannot practice aromatherapy. So if we take, to start with, what is a difference between the French way of working with essential oils in clinical settings and many other countries around the world, such as the UK, Japan, and other countries such as Australia, the question to ask is, in whose hands is aromatherapy delivery? And in France, you have a really strong approach where aromatherapy is in the hands of medical personnel. And that is quite different to the majority of countries outside of France, where aromatherapy delivery in clinical settings is not necessarily required to be in the hands of medical personnel. So we have professional aromatherapists that are independent practitioners who are trained very well in aromatherapy with good curriculum and good training, that are able to work in clinical environments without being a doctor or a nurse or a pharmacist. And I think that's one of the biggest differences between the French way of incorporating clinical aromatherapy and how it's practiced elsewhere. But there are also really good similarities, and one of the main similarities is really we're all trying to do the same thing. We're all trying to make a difference at the bedside of the patient who is suffering. And what I have seen over the last few years in the French style of aromatherapy is that you are increasingly placing emphasis on the importance of psychosocial support. And so we use essential oils in very similar ways, predominantly with inhalation strategies, whether that's olfaction or inhalation for respiratory benefit, or topical applications of essential oils for pain management or symptom management. So where at this one stage you could say the way aromatherapy has evolved in these countries is different, in the end, we are all actually doing very similar things in the way we practice and deliver essential oils to sick patients. As director of ICAN, the reason the platform was created was to bring together people from around the world who were professionally interested and professionally involved in clinical aromatherapy. In terms of how aromatherapy is practiced, or what is the aromatherapy ecosystem in different countries, it's been very interesting for us to see which countries are mainly represented for aromatherapy on the platform. And it's been very revealing to see. Currently, we have almost 1,000 practitioners that are users of our platform, and they are coming from 74 different countries. And we are only 1 year old. And this is a growing platform where we are having increasing numbers of people joining us. What's very interesting to see is that there are some key countries where aromatherapy is most represented. Countries like America, the UK, Australia, the Netherlands, Canada, France, Brazil. These are countries that have good numbers of professional practitioners of aromatherapy that are delivering care to sick patients. And then we also have a multitude of other countries where we have smaller representation, but where aromatherapy is less established and now growing. And especially one area of the world to watch with regards to clinical aromatherapy development is the Asia Pacific area. There is a lot of new growth and interest in this region, and a great move amongst professional practitioners to come together and create professional aromatherapy associations, serious colleges of aromatherapy, sufficient training so that care can be delivered in healthcare settings in their respective countries. So it's been very interesting to see how aromatherapy is growing or stagnating or even declining in certain countries, according to how long aromatherapy has been present and has been established. And it's often in the emerging countries where aromatherapy is going through a boom phase, where we see the most movement towards establishing standards, establishing good education, and also looking at ways of integrating aromatherapy in healthcare. In some of the other countries that are well represented with aromatherapy, such as the UK, such as Australia, and in some places as well, some states in America, where aromatherapy has been around for a very long time. We're talking about more than 30 years of history of aromatherapy establishment in those countries. It's interesting to see that they are not always the countries that are driving aromatherapy forward, because they're so established that perhaps there's a degree of stagnation. And I think this is really important, where we have the possibility, if we come together as practitioners from different countries, respecting each other's differences and also sharing our similarities, that we have this wonderful opportunity to move aromatherapy and reignite aromatherapy in some areas where perhaps things are less active. When we look at how and where aromatherapy is practiced in healthcare settings around the world, what emerges are 4 strong areas. The first area where aromatherapy is practiced the most is in oncology care, and that may be acute oncology care, supporting the patient whilst they're undergoing their treatment for their cancer, or it may be in supportive care if the disease progresses. And here we're really working on the psychosocial benefits, helping the person manage their anxiety, their fatigue, but also with regards to symptom management. And this is something that's become particularly strong in clinical aromatherapy in recent years. Things like nausea management, malodor management, pain control, etc. The second big area of aromatherapy provision is in end-of-life care, working with patients who are living with life-limiting illness, who are perhaps approaching the end of their lives. So whether that is in hospice or whether that is in the home, patients are supported along with their carers and their families to enable the most comfortable journey possible in the last stages of life. The third area where aromatherapy is delivered effectively and globally is in elderly care, and this is with particular emphasis on dementia care. And this may be helping on simple levels by providing activities, psychosocial support, but it can also be orientated towards improving appetite, helping with disorientation, helping with agitation. And so there are multiple reasons why aromatherapy has such a strong benefit in that particular area. And with an aging population in so many countries around the world, the emphasis on elderly care and elderly support is really reinforced. The fourth area where aromatherapy is delivered in numerous countries around the world is in midwifery care. And this may be for prenatal support, or it may be during labour and delivery, and it may also be delivered for postnatal support, for example, with postnatal depression and helping the new mother best adapt to the care and to her newborn baby. There are other areas of aromatherapy that are really emerging at the moment, where aromatherapy is really starting to be delivered. And one area to watch over the next few years is in the field of psychiatry and psychology. We have increasing numbers of practitioners working in these settings, which is relatively new, but is certainly growing. And then lastly, due to the particular circumstances that the world is facing, there is also an emergence towards using aromatherapy in helping patients with long COVID and with the fatigue and the multiple issues that have come as a result of the COVID pandemic. I think the way forward in clinical aromatherapy is to keep the focus on the patient themselves and to remind ourselves why we are doing what we do. So the patient's needs are our priority. We are trying to make a difference at the bedside. And if we remember that evidence-based medicine is constructed with 3 pillars, the first pillar, of course, is evidence-based, proof of efficacy, why we choose the oils we do, why we choose the doses and the methods of administration. But there's also the second pillar, which is the clinical expertise of the practitioner, their level of training, their experience, their ability to source correct information and correct tools for applying the care. But then we mustn't forget that third pillar, which is the most important, and that is the patient themselves. And that third pillar is the patient's needs, their expectations, and the patient in their globality. So we're looking at their mental, emotional, physical, and perhaps even spiritual needs in order to deliver the best care possible.
This was a podcast produced by the Gattefossé Foundation for Clinical Aromatherapy. Thank you for listening and stay in touch.